So this is a really classic, elegant face with a nice heart-shaped face, and then a lot of the changes that we very frequently hear complaints about, where we have these little fine radial lines around the lips, and they're really the function of the muscle around the lip, the orbicularis muscle, which is a pursing muscle. It purses your lips a little bit and relax, and you can see that makes the lines deeper. And that and sun damage, with age, are the three factors that create these very difficult to treat lines. And we're going to talk about and show some examples of how we can make these lines better and ultimately disappear by doing different types of skin resurfacing, which really come in three categories. And those three categories are mechanically abrading the skin, and that's the old-fashioned dermabrasion, sanding of the skin, which is the original resurfacing, deep chemical peels, or laser, and then the newest version of laser, fractional laser resurfacing, where instead of the entire surface of the skin being treated, there are little dots of thermal injury that are applied, and we control the density and the depth of those cells. In other words, how close together the little dots of thermal injury are, and then the depth of injury. And in general, the deeper the injury to the skin, up to a point, the better the outcome. But we don't really want to get up to that point, because then you get side effects like scarring or loss of pigment. And so the newer technology with fractional laser resurfacing allows us to treat in general areas or to treat the whole face. But this area around the mouth in particular is one that is really a nemesis for many people, because it sort of strikes of aging even in people who aren't that old if they've got sun damage and they're genetically predisposed to this. And otherwise, the proportionality of the face is quite good. So we'll be working on that and talking a little bit more about resurfacing. I think the important thing to keep in mind, in particular with any type of skin resurfacing, is that it is a controlled injury to the skin surface. And that's really what we're doing. We're purposefully injuring the skin and stimulating a wound healing and remodeling response that improves the quality and the surface texture of the skin. And that's a really important concept, because the laser functionally doesn't make the wrinkles go away, nor does the chemical peel or sander. It's really the body's own repair mechanisms that we're activating by creating a controlled surface injury. In the case of lasers, it's light or thermal energy, or as people often describe, a burn. And it is, but it's a controlled thermal injury. In my mind, it's very different than a random burn, like you touched a hot stove. And it's the same thing with a deep chemical peel, except there's not heat energy, but chemical energy that is breaking down the outer layers of skin to the second layer of the skin, the epidermis and the dermis, the two main layers. And we're going down to the papillary dermis, or the junction of the papillary reticular dermis, when we're doing the ultimate results. The background that you hear is the sound of a very expensive laser that we'll be using today to treat this area. And I think it's just the area around the mouth and lips is a really critical area for restoring a youthful massage, a youthful appearance for people. And we want to keep it natural. That's a key factor. I'm going to go through a few of the commonly asked questions about skin resurfacing. And I mentioned already that one that we talked about how it works, but it's a controlled surface injury. And then the most common thing that people ask is, how long do I have to heal? And how long does the process take? And generally, that's very different depending on the technology we're using. But with fractional laser, it's typically 6 days to makeup, is what we say. And we're keeping the skin moist with some type of ointment in the post-operative.